Fasciitis is the most common cause of heel pain. So what exactly is it and how can it be treated? We turn to Dr. John Harris, a foot and ankle specialist with Spectrum Health Medical Group, to find out.
Plantar fasciitis is an inflammation where the plantar fascia attaches to the heel bone. The plantar fascia itself is just a ligament. It's just connective tissue with no nerves and no blood supply, but right where it attaches to the heel bone, the covering of the heel bone does have nerves and a blood supply, so right where it attaches you get pinpoint pain right to that area when there's tension on the fascia. The plantar fascia takes origin off the heel bone here, runs up through the arch and connects at the base of the toes here. And then right where it attaches to the heel bone here is where people get the pain, right at that attachment. Patients that typically are on their feet will see this more. It's not that being on their feet caused it. They had the predisposition by having the flexible flat foot, but because they're on their feet, they're able to express that pathology. The main cause is flattening of the arch when people stand. That causes tension along the bottom. It pulls on it. So a flexible flat foot is the main cause of plantar fasciitis. Most patients describe it as a pinpoint ice pick stabbing pain right to the bottom of the heel when getting up from rest, whether it's first thing in the morning or whether it be a break at work and then they stand back up 20 minutes later. That after rest type pain is classic. Then as the day goes on, it's more of a toothache throbby pain that comes on after that sharp pain is resolved. Best way to deal with it is to treat that problem, that flexible flat foot that allows it, hold the arch up, have a rigid insert that holds the arch up, not allow that tension along the bottom of the foot. We fit them with the prefab orthotics to trial initially. If that fails, we can send them for custom orthotics. As far as the shoes, we'll get most people into a cushioned running shoe initially, and then after the symptoms are resolved, we'll look at more of what's specific for work that they need, if it's a different style of shoe. First thing we're going to do is get them in orthotics to help hold that arch up. We're going to get them into a cushioned shoe. Then we're going to have them start doing some stretching exercises for their Achilles. They're the three hallmarks of treatment conservatively. We actually found out in the late 80s that the heel spur itself doesn't cause the pain. Okay. It's just visual evidence of the tension on the fascia. Okay. But it's actually because it has no blood supply and no nerves, so you can't actually feel pain.
Right.
Just like if you were to rupture your ACL, you don't say, oh, my ACL hurts. It's the derangement of the knee that causes pain, not the actual rupturing of your ACL, because there's no nerves in the ligament, and the plantar fascia is just a ligament. And that's why it doesn't hurt along the whole fascia, because there's no nerves. It only hurts right where it attaches to the heel bone. For the vast majority of people, conservative care takes care of it. For the few that do slip through the cracks and conservative care does not take care of it, there are surgical endeavors. We can lengthen the Achilles, we can cut the plantar fascia itself. There's lots of different surgeries to address it. There's some other variables that are factored into that equation, but most of the time this is able to be treated conservatively. We can resolve symptoms. Wow. That is the goal, to have resolution of symptoms long term.
Our Spectrum Health Medical Group is offering a free community seminar that will discuss solutions for foot and ankle pain. It's Monday, May 18th at 7 p.m. at the Prince Conference Center at Calvin College. To register, visit shmg.org/events or call 616-267-2626, and then you'll hit option 4. And if you'd like to get in touch with their foot and ankle specialist, you can visit them in offices on Lake Drive in Grand Rapids and Wilson Avenue Southwest in Wyoming. They're also available by phone at 616-267-8860 or visit them online as well.